Well, we continue here at News 4 to try and get answers to the questions so many of you have during the coronavirus pandemic. St. Louis County Executive Sam Page joins us live again this afternoon from the county's Emergency Operations Center in Baldwin to answer some of the questions we might have. Dr. Page, thank you again for your time today.
Good afternoon.
Well, the president, we heard just yesterday, he's extended social distancing guidelines through April 30th. We are curious, is St. Louis County considering doing the same thing? Should we be prepared for stay-at-home orders to be extended?
Well, I think we should be prepared, but it's hard to make that decision with the information we have today. We really need three things to happen for us to relax the social distancing guidelines, which really are life-saving because they prevent the spread of the virus in our community. We need to see what the hospital capacity is and how well the hospitals expand with the surge, and we think they have a good plan in place. We need to watch the testing, and we'd like to see the testing falling off, but we also need a very robust testing environment where we have all the tests we need, and that's a very tough situation right now with the national shortage.
How many tests are we conducting every day in the county, and how many do we need to be conducting?
Well, I think we're conducting about 1,000 a day, but we're still left with national CDC guidelines on the tests in a relatively short supply, just like the rest of the country. And those guidelines are limited to doctors and nurses, people who are sick in the hospital, first responders, and people who have chronic medical conditions and also have symptoms, and also people who've been exposed to someone who has COVID-19 infection and they also have symptoms. So we'd like to expand this testing much more widely. We just don't have enough tests, and we're following, for the most part, following the CDC guidelines with a few exceptions in the St. Louis region.
It appears not everyone is following the social distancing guidelines we have. Just a few moments ago, we learned to close the basketball courts in St. Louis County parks to the public. The weather is now warmer. What else can the county do to enforce this?
Well, I think what we first need to do is let us know when you see something. stlcorona.com is where you can go to find out more about St. Louis County's response, to have your questions answered, and also let us know if you see anything out of order with social distancing guidelines. Our attorneys have been receiving those complaints for the past 3 or 4 days towards the end of last week, and they'll have a report for me later today, and we'll make some decisions about how we communicate our concerns. We do know that there are some problems in our community. As we drive down the roads, we see the interstates are light. We see the streets look like early Sunday morning, and there's not a lot of traffic, but we also know that we need to do a little better job in enforcing social distance. How well we do this will determine how well our hospitals can handle the surge in patients who are sick and need help.
Give us an idea what your office is doing right now around the clock to get more testing, more personal protective equipment, more ventilators in the county. Who exactly is responsible for the holdup? Who needs to be accountable for this?
So our hospital systems are working very closely together to try and procure their supplies, their supply chains. They are coordinating their resources, they are coordinating their decisions, and they're coordinating their policies and working very well together. Our public health departments and regional leaders are in constant communication. What we're faced with is a national production shortage all over the country. PPE is in short supply, tests are in short supply, ventilators are in short supply. We're working very hard to make sure that we get the resources we need. The most important thing we can do as a community is to limit the spread of the virus so we don't need as many resources. We're struggling with everyone else to get those here. We're purchasing things for millions of dollars. We're purchasing things that cost 5 times as much as they did 6 weeks ago, but we're getting everything we can get our hands on and getting it here. The folks behind me in the Emergency Communications Center are working around the clock. We have a table full of 6 or 8 people that are calling and searching all over the country to buy the supplies we need right here in St. Louis County.
We get so many calls in our newsroom, so many emails to the newsroom and to individual reporters and anchors asking why the county won't release details on the general locations of positive cases. Just today, in fact, the city is saying it has a list of cases by zip codes and is working right now to release that information. Is that something the county will be doing? We've seen in other areas like Dallas, New York, Los Angeles, they release similar information. Will you be doing that? And if not, why not?
Dallas and New York and Los Angeles are well ahead of us on their infections. on their impact in their community, on the number of cases. And as we move forward in this process, we'll have better reporting software, we'll have better collection information, and we'll be able to release some statistics. Right now, it would be overwhelming to do this by hand and would cause us to stop and slow down providing the life-saving services that we're providing. We do have to balance the need to let the public know what's happening and give the public information about the coronavirus and the types of patients that are being affected, and we'll be producing that data. But we also have to be very cautious and very respectful to the HIPAA law and federal laws about patient privacy. And we'll find that balance. I suspect that our reporting will be similar to the other major metropolitan areas, but we need to get our software in place to collect that data. It is really overwhelming to try and do that by hand, and it would cause us to come to a complete stop in providing the other services that we're providing right now.
Dr. Page, we want to thank you for your time, your willingness, your openness to answer our questions live on air, and we truly hope this is something that we can continue to do as we navigate these unprecedented times together. Thank you again for your time.
Thank you.
Well, coming up next on News 4 at 4, who do you